implemented a malnutrition reimbursement program that helped increase the appropriate diagnosis of malnutrition along with the appropriate coding so we could increase the reimbursement of it. I see a growing awareness amongst not just doctors, but all of our clinicians. My dietitians are getting consulted more. We had a doctor call one day to ask about discharging a patient. He was like, do you feel that they're good to go home? Which hardly ever happens with a dietitian. You don't really see the dietitian being the one that's given the okay to send home. So the doctors are recognizing that very important role. Malnourished patients, when they leave us, they normally will bounce back within 7 days. And with readmission rates, being hit for readmissions, that's also critical. So you want them, when they go back out into the community, you want them to be as healthy as they possibly can be. I think for us, you get more contact with the dietitians, you're getting more contact with the nurses, because my staff has increased, so you're getting that increased contact. Patients are leaving with more education, a better understanding. They're also getting that education while they're here. They're getting that encouragement. The patients are empowered to take their health care into their own hands, both here and outside of here. The overall satisfaction scores have gone up. We've seen an increase in satisfaction with our doctors. I've seen a massive increase in satisfaction with my employees. So that has been like the one thing I have to say. Being recognized as the peer that you are really goes a long way. This is huge. Our business is food. It has been food. We all can sit down and agree that nutrition is important. That's our business, is nutrition. This program takes it to that other side. For so long, nutrition has just been part of room and board. Well, it's nice to show that we pay for ourselves. There's return on investment. The future of dietitians. 20 years ago, dietitians didn't diagnose and they didn't lay hands on a patient. But now we are fully licensed to provide nutrition diagnoses, such as malnutrition, as well as lay hands on a patient. There are other dietitians in the country that are dropping tube feedings tubes down patients. They're implementing. They're not just working with a doctor. They're actually placing the tube. And that is exciting because that actually takes everything that we have learned in school, our internship, and allows us to fully implement everything. And that is what is truly exciting. So we're moving from, I guess, what have been kind of a behind the scenes quiet position to actually being frontline caregivers. And that is exciting. Other facilities can take what I have done and implement it. It's a collaborative effort between the dietitians, between the doctors, as well as all of the other interdisciplinary teams that you have in a hospital. And what I would also say is, because I'm self-op, all departments have been open to me. I've gone into coding, medical records, with the doctors, wherever I need to go, those doors have been open to me. Normally in a contract situation, you don't see that because everybody they're behind you. You're not quite with us. But being self-op, we're a team. We're all in this together. I could not have asked for a better experience during my first year and a half here because I was welcomed and with open arms within all departments. Everybody wants to see our hospital succeed. We all want to ensure that patients are getting the best care possible. This program does that.